Buvidal is a buprenorphine long-acting injection. It's a monthly injection and which helps with opioid addiction or heroin addiction. It started as a pilot here in Wirral. We had another pilot in another service in CGL at that time, and we had only 20 service users on it at that time. We now have got around 100 service users on Buvidal, and it is working really well in most of them. So the main benefit is that you don't need to attend the chemist on daily basis like you do for methadone or like you do for buprenorphine or aspirin tablets. You have to go to either chemist on daily basis, sometimes supervised as well, which can be really troublesome for lots of service users. It does not give them flexibility. But what Buvidal does is that it gives them flexibility, it liberates them. So they don't need to go to the chemist, they come to our service once a month, have the injection, and then they don't need to worry for about a month till they have another injection.
Initially they see the medical person who is going to review them and discuss the options of treatment, and if they between themselves decide on Buvidal, then they're booked into the clinic with me or one of the other nurses. And we here tend to mainly do an initial treatment of an injection for 1 week, and then we see how that goes, and then we move on to the monthly injection the week after.
After third or fourth injection of Buvidal, the levels of buprenorphine in the blood, they stabilize. So there are no peaks and troughs up and down in the buprenorphine levels. So you don't get any significant withdrawals. It helps you feel much better without experiencing any withdrawals, which means your overall functioning improves significantly.
There's various sites we can give the injection, and the main thing is that we don't go to that site too regularly. So we switch where we give the injection each time they come in, and then they often find a place where they sort of prefer, and we kind of stick to that. So yeah, it can go in the arms, in the legs, the tummy, the buttock.
Number one, if somebody has got severe liver problems. Second would be if somebody has got severe breathing or respiratory problems. And third contraindication can be if somebody is using alcohol excessively or they have got acute alcoholism. And fourth one would be if somebody is allergic to buprenorphine or any of its products. So these are the main important bits we need. These are complete contraindications where we can't give Buvidal at all. Most important being if somebody is using diazepam or benzos, that can cause problems because there is a risk of overdose with Buvidal. So we have to be a bit cautious. So we may ask a service user to cut down on their benzo use or stop benzo use completely. Second would be if somebody is on gabapentinoids like pregabalin, gabapentin. Again, they can suppress the breathing, which can result in overdose, especially when used with Buvidal. So again, we have to look into if somebody is using these tablets excessively, then we have to advise them to stabilize before we can start them on Buvidal.
Regarding the pain, sometimes it is painful, but they come back month after month and they'd say, oh, it's painful, but it only lasts a little while and it's worth the pain. Some people don't really find it that painful and say, oh, is that it?
Yeah, when it comes to changing, if somebody is on buprenorphine tablets or aspirin tablets, it's much easier to change to Buvidal. We do a simple conversion, looking into the appropriate dose of Buvidal based on what dose of tablets they have been taking. So it is pretty straightforward. But when it comes to methadone, we have to then plan it quite well. If somebody is on higher dose of methadone, say 30 milligrams or higher methadone doses, then we have to reduce the dose, especially if they are on 40, 50, 60 milligrams, then we have to reduce the dose and reduce it to 30 milligrams or lower, and then stop methadone. So we have to stop methadone for around 24 to 36 hours so that they are in mild to moderate withdrawals to have that first dose of buprenorphine. What we then do is we ask them to come here and we give them a test dose of a tablet, buprenorphine tablet, which is 4 milligram, and we watch them, we observe them for half an hour, and if there is no reaction, then we can give them first injection. It could be someone who is new to our service, who are not on anything at all, and they want to straight away go on Buvidal. So we can do that as well. We have to check their history. We have to look into if they have tried buprenorphine products before, and if they have tried it and they haven't had any problems, they can be considered as long as there are no contraindications to it. And then we can book them into the Buvidal clinic. Again, we could try a test dose of buprenorphine tablet if they have not tried buprenorphine before, or we can straight away give them an injection, which is usually a weekly injection, and then we move on to monthly injection. Buvidal has helped significantly in some of our service users, and we are proud of their progress. We had some very chaotic, unwell service users who struggled to stay on the script and were off script all the time, and they were sort of injecting and they were homeless, and there were lots of other risks involved with them. And Buvidal has helped to stabilize them, and they are back to their normal self. Their physical health has improved, their mental health has improved, they're engaging much better with us, and they have reduced their illicit drug use, and some of them have almost completely stopped it, which is a brilliant achievement in some people who were really struggling before. And these are some of the service users who were also involved in criminality as well. So there has been a reduction in criminality in some of our service users because of Buvidal. So it has really worked very well in some people.
People are starting to go on holidays. People are able to find working a little bit easier because they don't have to go to the pharmacy, and they can just sort of have their injection and then not think about it until their next injection. One thing that most people say is that they enjoy not having to go to the pharmacy every day or not having to take their medication daily, where they experience sort of like the feeling of the medication running out before they take their next dose.